Hey everyone, welcome to the West Clinic Podcast. I'm so excited about this topic, number one, and to have my special guest, the world's greatest nurse practitioner with me, Shelby Stoddard, who's a unique and gifted healer inside of the office. And just so you guys know, we are up on iTunes, we're on Spotify, we're on Facebook, we're on YouTube. I'm so excited to talk about this system. And if you need more information, the West Clinic Online, you can do that way, or we actually have a free ebook on today's topic, which I'm going to turn over to Shelby in just a second on drjasonwest.live. So you can go to us at the clinic. You can like us on social media, Facebook, give us a rating if we provide value for you. And we are going to deliver value because this topic is so important. So Shelby, tell us what we're going to be talking about.
We're going to be talking about hair falling out.
Now, hair falling out, I mean, there's a lot of guys coming in with hair falling out. Some of it's genetic, some of it's, stress and pressure and stuff like that, but it's a little bit different ballgame with women.
Women are attached to our hair. We're attached to our hair. I can speak for many women, I believe.
So how did this come up? I mean, just walk us through what happened, because it wasn't really on my radar. And then as soon as it was on my radar, it's everybody.
Yeah, so this week we had one of our workers in a morning meeting. She was very devastated because she started losing her hair. So not just like one or two hairs, like a whole clump of hair. And so she hasn't been feeling well, but about 3 months ago she got, a novel virus. And since that time, 3 months later, she's losing her hair in clumps. And so not only her, but so many more people have come in and said that they're doing this, having this happen. And I even had one lady say, I would rather have cancer than have my hair fall out.
Yeah,
which is very powerful.
It's very powerful. And, Tori's kind of silly boss, which is me. When she says that, I was kind of like teasing her a little bit. I didn't recognize, like, she was really worried about. There's a lot of emotion behind it. And then when I saw that, I was like, I need to, because to me, she looks like she has a head of hair. Like,
right.
I'm not seeing so I was kind of, I like to joke around with the staff and everything. But as soon as she said it, I think I got asked by 4 or 5 people that day that the hair is falling out. And then I'm like, hey, Shelby, come over and get on the podcast. And you said, what should we talk about? I'm like, well, I kind of should talk about Tori's hair falling out. And I've been asked like 8 times since then.
Yeah, I would agree. It's been something that's been on the radar for a while.
So what do you think it is? Like, what is this? Like, as we've been preparing for the show, you're like, hey, I think I know what it is.
Yeah, so I believe that it's called telogen effluvium, which is the cycle of the hair. We have several different cycles of the hair falling or cycle, and so the telogen phase is the resting phase, and so then after an incident, trauma or virus infection, anything, about 3 to 6 months, usually about 3 to 4 months is most literature, is when you have hair coming out in clumps.
So it's not just necessary the little bug from China. Like, it's not unique to what's happening in the last 2 years.
No, it's not unique to that, but it is, I think it's more unique because it's happening after this virus because of all the stress that's associated with it.
So every week I talk about stress and stress management, which I'm going to ask you in a little bit because you've given me some really good stress advice and some other things. So if people don't know, like, Shelby's my go-to Zen master treating physician. And when I get worked up, a lot of times you'll say, hey, you should do this. So we're going to talk about the stress management, but I just wanted to point out, it's not just the new virus. Like, it could be, Epstein-Barr, or it could be stress from like a car accident or a job change or kids leaving or divorce or like any of these big emotional markers. It's not unusual for your hair to fall out with the same thing, right?
Right. And so there's many different reasons why hair falls out, and it can be genetic, it can be a disease process, it can be from stress. It can be from medications, it can be from hormones, it can be from diabetes, it can be from many, many things. But I think in our case with what we're talking about with this, after a virus or infection, it's definitely a reversible thing,
Right.
not really genetic in nature. And so,
And I talk about every week of, hey, the key to taking care of autoimmune or Lyme disease or neuropathy or whatever is balance, balance, balance. So this kind of doesn't fall out of that realm. And we're not talking about genetic hair loss. It's not like you have male pattern baldness. It's a male, and it's, your dad and your grandfather and all your uncles and stuff. This is a little bit different, and there's actually a little bit of good news on the horizon for Tori, because Tori was saying, "Oh my gosh, I'm falling in." I had another patient. You've had some patients that do that, and there's a little bit of good news on the horizon. And so, what is it?
So we can do some things to help.
Yeah, we can do some things to help, and also, yeah, of course,
It's
and then,
reversible.
yeah, it's reversible, and I think the literature was saying that it will come back if it's, and I can't remember what you called it. What was the big words?
Oh, the telogen.
Yes.
Here, let's say this again. Telogen euplevium.
Yeah, see, that's why I got Shelby on here, because I'm like, I can't even say that.
That's
So
funny.
so it has a tendency, like, it'll come back. Now, it's been my experience with stress before of the recent 2-year episode. In the experience that I've had in the past is a lot of times the hair will come back. Sometimes it comes back whiter or finer. I mean, it doesn't always come back exactly how, but it does have a tendency to come back. And there's some really neat things to help accelerate that. So what would be your advice, recommendations of, okay, so we have a patient that has their hair falling out 90 days after the big event that's happening right now. 90 days after that, their hair starts to fall out. They come into the office and they're saying, "Oh my gosh, we got to do something." What would you say to do?
Okay. So first, we already decided the patient history is super important.
Right.
We've already decided that it's not related to anything, but they've had this traumatic event or infection. So we're just going to go with that. And so they call it telogen euplevium, and it's because of just the way it is in the hair cycle. That's, if you look at the bulb of the hair follicle, you'll see that it's in that phase, and that's usually when you lose most of your hair. Sometimes you can lose up to 50% of your hair during this.
Well,
so please
that's
don't.
a lot. Wow.
Calm down, Tori.
Yeah. We keep talking about Tori because, and Tori,
She allowed us to.
yes, was gracious enough to say, "Hey, you can talk about it." But I've had patients A, B, C, D on Monday and E, F, G on Tuesday that were saying, "Hey, that's affecting me as well." So walk us through, Shelby, how you put someone back together. They've had this big thing. Their immune system's a little bit off. We know that they've had really stress. So how do you put people back together?
So the goal is you want to increase blood circulation to the scalp, and then you want to provide the essential nutrients for hair growth. And I think nutrition is super, super important. And that's, kind of what we do with our nutritional supplements, IVs, and the like. And so what's nice about the clinic is that we have so many resources. We have you, we have Dr. Nelson, we have myself, we have all the studies that your dad has done and books and stuff. And so we can pull together a traditional medicine, Chinese medicine, integrative medicine, natural medicine, all those things. So we're going to increase blood flow. We're going to provide essential the nutrients for hair growth. So, and then we're going to look for other causative factors, which most times it's adrenal glands. So the adrenal gland stress is probably number one, I would say.
And this is fascinating, Shelby, because we have a way to evaluate stress that's a little bit different, called Ragland's test, where we get people to come in. And I just would love to hear kind of your thoughts on that simple test and what it tells you if people are stressed.
So what we do is we have them come in and rest, and then we have them do a lying blood pressure and then a standing blood pressure. And there's a process that goes along with that. But what it tells you is if you don't have a change in your blood pressure, then your adrenal glands can be compensating, but yet not optimal. And so there's a certain degree of change that you want to see when we do that. And so it's just an easy test you can do in the office with the blood pressure and the heart rate, and just to evaluate how the adrenal glands are doing. I mean, that's your powerhouse for your regulation. I mean, there's some other things that go along in the neck, baroreceptors, and those things that do that, but that's just something that's not utilized in regular medicine quite as much as what we do here. And so it's really cool. It's pretty neat.
Yeah. So going back and just starting at the very beginning, and you've done this for me quite a bit. It's a stress event, from physical stress, emotional stress, spiritual stress, etc. So give us a real quick summary of what do you do for people that are stressed? Like how do you help with that? And I'm not talking so much about a nutritional thing, because we're going to cover that a lot in a minute. But from a lifestyle standpoint, I just love some of the things that you've told me. So what are you telling other people?
So just really figuring out your why and your purpose, and knowing figuring out what your stressors are. Just getting to the underlying root of what is causing stress. Now, we've identified that it was a virus for this case, but there's also other things that go along with that. And so usually a lot of times even before that 3-month period, there's something that happened in your life that caused that. And so it's just getting to that root cause, figuring out what that is. And it doesn't matter what it is, just figuring it out and trying to working through it and move through it and doing it.
And in your experience, a non-prescription, non-nutritional, non-treatment way to deal with stress, like what's your favorite advice to tell people outside of the office saying, like, this is what you should do for stress management? Because you can't get rid of it, right? Like there's no like lotion, potion, or pill that completely removes stress.
Right.
But like, I was raised with really, really workaholic parents that I get separation anxiety when I'm not at the office.
Mm-hmm.
And I've talked to you about this a couple times, and you're like, hey, Dr. J, like, you just need to be you need to go. So along that same vein, someone's coming in, lots of stress. They're worried about their hair falling down. And our first step is, look, we got to help manage the stress. What's your favorite advice?
Doing what you like to, getting out in nature is a thing. Like in nature is huge. There's lots of studies that show the frequencies that help you relax and just getting that mind clear and, all those things. And so getting out in nature if you can, if it's something you like to do, or doing something that you like figuring out what you like and do it.
Right. A healthy hobby, a healthy, like something that is really not work related. It's not financial related.
Yeah.
It's just like, hey, this is how you blow off steam.
So you can get into your nothing box.
Right. Getting to your nothing box. Matter of fact, I'm reading this book called Limitless by Jim Quick. I love to read. And he was saying, it's kind of got me freaked out a little bit, because one of the things he's saying is like technology, like it can rot your brain, and you need to like disconnect from it and then just have periods of silence.
Yes.
And so I've only been doing this for 2 days, but he's like, look, take a half an hour, disconnect from everything, and just be with yourself.
Yep.
Which when I first started doing, I'm like, oh, I'm so unproductive. Like I can't do anything. I'm just sitting here. And then as I kind of like got past that point, I got past the, what if someone texted me? What if someone, I got past that. And then I just had some really cool calmness that came through. And so I'm like, okay, I'm only 2 days into it, but I mean, important to disconnect. So walk us through, like, what would you recommend from a liquid and a food intake to help with stress and to help put the building blocks back into the hair follicles?
So I would say foods for, to get your minerals, vitamins, essential fatty acids.
But all food isn't created equal.
No.
So what is your like go-to food? What do you think people should be eating?
So, I mean, spinach, parsley, celery, avocados, carrots, potatoes, watercress, asparagus, beets for sure.
Yeah, I know you're the beet woman.
I
Like, you're
love beets.
beets.
The stem, the root, the stem, and the leaf, because it gives you that. Also gives you betaine, which is really good for liver stagnation. Which in Chinese medicine, if you have hair loss too, then that can be related to liver stagnation and spleen stagnation. So you're not circulating the blood as you should, and so beets really help that.
Okay, so then so I'm eating my vegetables and my live plant matter, and let's walk through some liquid intake options, because there are so many times when people get stressed and then they go to liquid intake and they're intaking the wrong thing. So what's the thing that you shouldn't be doing for liquid?
Well, alcohol.
Well, alcohol's one. What else?
Lots of caffeine. Fruit juices, don't want to do those. So you really basically, I mean, you can do some, coffee, teas that don't have sugars, nothing in them, 1 or 2 cups. But more than that's not really helpful. Water.
Yeah.
Water.
It's I was going through some of my dad's old literature, and I ran across a thing that said that there are 4 essential nutrients, and this is like 1916, and it was vitamins, minerals, fats, proteins. I guess there was 5, and then water. They listed water as essential nutrient. I'm like,
yeah.
How did we go away from this? Of course it is. Like, so many people are not adequately hydrated.
Mm-hmm.
So then moving on, so I managed my stress. I'm eating better. I'm avoiding, and I wanted you to say acid. Like, no one should be drinking acid, which is, basically sugar that we boil or we bubble carbonic acid through the soda pop,
So yes,
which is just crazy because I saw another report that said that the average person drinks 75 gallons of soda pop a year, like which
I
is
believe it.
it's mind-boggling. And so a lot of people are saying, oh, it doesn't have an effect on your skin or your hair. And I'm like, yes, it does. So we're kind of covering that one. So what else would you do to like put the body in balance? We're going to be talking about like, let's do immune system first, and then let's talk about baseline nutrition second. So someone comes in and they say, hey, I have this viral infection, and I'm just going to pick on let's pick on shingles. Someone comes in and said, having some shingles. I just want to be healthy again. What are you going after? Because I believe that this goes after all viruses. So they walk in, they say, I have shingles. Shelby, what are you doing?
So we're doing nutrition support, we're doing IV therapy, we're doing neurotherapy, and we're doing mind-body wellness.
Okay, so let's just break those down. The nutritional support for immune deficiency, because everybody's saying, hey, how come I don't want to run into this virus, or I don't want to get parasites, I don't want to get amoebas. And my response is, look, that's not possible. We can't put you into a plastic bubble and
Right.
hide from the world. So it's not about avoiding it. It's about dealing with it. So when you come in contact with someone that's had the virus, you want to have a strong immune system. So how are you building up their immune system?
So we're giving them supplements.
Yes.
too.
Which ones? That's what I'm trying
Okay,
to do.
so
Like
liver-
specific supplements. What is your magic?
So calcium lactate
Okay.
is good because it helps envelop viruses.
Yep.
And actually,
That's the phagocytosis
Yes.
part.
so then we're doing liver gallbladder support because we need to get that circulation going. We need to get the immune system going. We need the lymph system stimulated. We're going to do obviously that's with spleen support. We're going to do thymus support, which is another immune system organ that helps to increase T cells and B cells specifically for your
And
immune
it's so
system.
underutilized in medicine. Like no one's talking about that, right?
This is a little thing, and then they just take it out too
Yeah.
sometimes. So
Oh,
anyway.
you don't need that. Let's
Yeah.
just remove it.
And then we'll do some adrenal support for sure because we need to get balance in the hormones again and organs. And adrenal glands have a lot to do with cardiovascular system, the digestive system, pancreas, thyroid, and hormones, immune system. So it's a super overlooked.
Okay. And by the way, you guys, if you're listening or watching to this, over at drjasonwest.live, if you go there, we have an ebook that you can download there. It's also on our West Clinic website. And the reason why I put that together is I just want to give people some resources because particularly the 4 women that asked me were like panicked. Oh my gosh, my hair is falling out. The good news is you said, hey, it's this condition that's usually stress related. Most of the time it comes back. It was a long time. Didn't you tell me it was like 6 to 12 months to come back?
Yeah, well, it takes about 6 to 12 months. So traditionally, medicine is like, well, you just spontaneously resolve 6 to 12 months. But the thing about that is like, too, is you don't just get hair back all of a sudden in 6 to 12 months. I mean, it takes a long time for your hair to grow back, sometimes several years. And so you'll start seeing baby hairs, but you're not going to have the long locks like you had for a while.
And you said something really good as we were preparing for the show. You're like, well, we should be able to accelerate that because if we give the body building blocks and put it in balance and making sure we have the proteins and the immune system supported and then the liver and this, which is awesome because when we first decided to work together 6 years ago, did you ever think you would be talking like this?
No.
Yeah, that's why
That's
it's
so cool.
Yeah, it's so neat. And that's why I'm serious, and I like
Yeah.
to tease you about it, being the world's greatest nurse practitioner, because you got this awesome skill set of, hey, I was trained in traditional medicine. I have an alternative medicine exposure. You've done this amazing job of putting stuff together. So let's go up a little bit more and talk about how infusion therapy and stuff helps with the immune system. And when we skip the gut, we can put the stuff right into the veins. So this wasn't something you were trained in, but you've had 6+, almost 7 years.
Yeah.
Is it it's 7 years in February?
It'd be 7.
Okay. So you have this exposure to this infusion treatment. So walk us through a little bit of what the exposure was like and then observations. Then the third part of that question is, well, how would it help put people in balance?
What you're doing is you're treating your cells. You're just bypassing the gut, going right to the cells. So you're getting that, you're getting the cell diffusion of nutrients through the cell, out of the cell. Your body, stimulating your body to do detox, get rid of toxins that our bodies normally do through other, many mechanisms, but this intravenous nutritional therapy is just accelerates it that fast because you're not even have to go through the liver, the gut. It's just right there for the cells to be able to do.
And when I first told you about it, so you decided, hey, we're going to go merge forces. I'm walking you through the office, and I'm like, hey, I just love to give tons of vitamin C. And I think you looked at me and like, oh, whatever. Like, surely it can't be that good. Or, I don't know what you were thinking, but I can remember you saying, well, I just haven't been exposed to it, which I appreciate. Like, well, she's open-minded. She's not like shut off on this. But now that it's like once you've been exposed to it, do you think you could ever go back into healthcare without it?
No.
Like, isn't it just
No.
like the most amazing thing
That's
ever?
like when I hear people in the hospital or they're doing this, that I'm like, oh my gosh, we need to get them vitamin C. We need to get them infused. And I think they're starting to do it maybe over, obviously they do it overseas, but maybe doing it in some bigger hospitals here and there just because they don't have anything else. They're kind of grasping. But if we did this so much sooner, how much healthier people would be and
Well,
faster they would heal for sure.
And this is tough because I have a really good friend that's 4 or 5 states away that was just diagnosed with a new variant and not in the hospital, really, really concerned. And he's like, what should I do? I'm like, you got to find a place that does the infusion. Like, you need to get a big wallop of vitamin C, and that's a technical term, a big wallop. But I was saying, look, you need to get 50 to 75,000 units. And what was fascinating is he's like, hey, I've been calling around and people won't do that much. Some people that are doing infusions, they're doing 5 to 10 grams, which is, I tell people, hey, if you come to the office, like, no one does as much as we do. Like, no one really loads you up. Now, the other thing that I wanted to talk about, which I think is you just turned into this amazing expert about, is a way to reset the nervous system, not only with, the skin layers and the organ structures and pain management stuff. And that's the neural therapy, the Sturman technique. We talk about the nerve reset therapy. And I can still remember our first patient that we walked in together. I'm like, hey, do some neural therapy. And you're like, what are you doing? And then you've had some really amazing, like powerful Huneke phenomenon, which is the special phenomenon, people that respond. So for someone out there that's listening that is worried about recovery from the infection and hair loss and just overall health, help us go through neural therapy. I talk about it every week. I just want someone else to talk about it. So what do you think about neural therapy?
So at first I was like, what are we doing?
It's true.
It's true.
Shelby would not be a very good poker player. I looked over, I saw her face. I'm like, yeah, she thinks that I am making stuff up for sure.
I'm open-minded.
She was open-minded is what came out of her mouth, but 80% of her communication was, you're crazy.
Yeah, we can't say that on TV.
Yes, right.
So neurotherapy really isn't like you're targeting the nervous system, like you're not targeting the nerve itself, right? You're not like jabbing someone's nerve, if you will, because that's what people think, that's their terms. What we're doing is trying to break up energy interference in diseased areas. So when the hair, we're speaking of hair, so the scalp, we would do some segmental therapy in the scalp. And why we would do that is because there's these reflexive nerve pathways, in the skin. And so they have mechanical receptors, chemical receptors, heat receptors in there, and they're called nociceptors. And we're trying to change that because they have all this interference. You have disease there, obviously, because you're losing your hair. Your cycle's off. And so what we're doing is we're resetting those receptors, basically.
And when you talk about resetting, like, how do you do that?
So what we're doing is we're using a needle. We're using a needle, small gauge needle.
Yes, really small,
Yeah.
tiny dental needle.
Right, and we're using 1% synthetic, or not synthetic, 1% compounded preservative-free procaine.
Right, so that's the glycolized ester of paraminobenzoic acid. It's kind of in the B vitamin family,
Yep.
and it has this effect on the nervous system. And your observation is what effect?
So your people are feeling better. Their symptoms will abate after, one treatment is not the norm. Mostly times you need several treatments. But sometimes people do. After one treatment, they're like, oh my gosh, this has been amazing. But I think for hair, you're probably going to need 6 to 10 treatments maybe, just to kind of get that reset. But you're just really changing the way the cells respond.
I love it because health is all cells, right? Like
Right.
that's what we talk about in the office. Like if your cells are healthy,
Yep.
you're healthy. So for anybody that's coming in later, joining us, we're talking about hair falling out after the infection that showed up. You know, a lot of times people are saying, "Hey, I tested positive for this." And, 90 days later, my hair's falling out. I've had, 4 or 5 patients just in the last 2 days. You said it's a temporary condition. Medicine, they're like, oh, it'll come back, in a year or so. We think we can really accelerate that based upon experience of getting people balanced and doing the infusion and the neurotherapy. And so not to get too political, but as you're hearing the people that are affected by the world's circumstances over the last 24 months, and then they're worried about this new variant. I don't want to diminish and say it's not affecting people and people aren't, dying in some other things. Although part of me says, are you dying from this or are you dying with this type of thing? But what is your general advice on, okay, in this day and age, how do you stay healthy? And when you see something on the news of all of this, stuff that's happening, how do you navigate that?
So telling people is, do your own research and not just believe what you see on TV. Obviously a lot of people have Google research or whatever, but there's all sorts of different platforms that you can get information from, podcasts that are out there, and just listening to it with an open mind and just feeling how it feels for you and knowing that not everything is for everyone.
It's true. And I tell people with any chronic health problem, whether it's Lyme disease or cancer support therapy or arthritis or autoimmune, it's kind of lonely. You're kind of on your own because you're the person that has a diagnosis, and then your neighbor tells you this, and your mom tells you this, and your dad tells you this, and your neighbor and your friends and the medical community and the alternative medicine community and the acupuncture community. Everybody's telling you to do different things, and people say, well, what do I do? And I'm like, look, you gotta become your own fierce advocate. Figure it out and research, and it's amazing to me because I feel I learned a really good basis in school. I learned a lot in postgraduate programs. I think I've learned more than that from just talking to people and then
Right.
coming in and saying, hey, this is how the rubber hits the road with that. So we're talking about hair loss after different types of infections and stress management, how we believe we can accelerate that process. If you want more information, you can go to the West Clinic online. You click on the new patient tab. You can schedule with Shelby. You can schedule with me. But there's also a book available on ways to help recover from this disease. And again, Shelby, you got to help me with how you say it. I'm not trying to put you on the spot, but I'm like, I can't even
It's
enunciate it.
It's called Telogen, Telogen. So Telogen, which is the bulb, the bottom of the bulb. You're identifying what part of the cycle you're in. Euplevium.
Okay, so the hair follicle gets stressed from infection, emotional stress, hormone imbalances. It basically kind of just goes on hold. It
Just fleas.
It flees.
Yes.
And then how we put it back together is balance, everything else. Then when we talk about the pandemic environment, you said learn, trust your resources, investigate resources, and then be able to, trust yourself to go through it. Your stress management advice is be you, get outside, have a healthy hobby.
Sleep.
Okay. Sleep.
And sleep.
Yes. If you
Number
can't
one.
sleep, you can't heal.
Yes.
And then, stress management. I love, you didn't put words to it, but I love the grounding concept. And the grounding is becoming one, with the earth.
Yep.
And getting out in nature and some other things. So we have a program that Shelby and I have developed that's available through our 3 ebook that you can get over at our livecast, drjasonwest.live. It's free. Just go over there, register, and then you can see this podcast later, but you can also get the free ebook. It's about 15 pages of stuff that we've put together in different supplements and recommendations. And then, Shelby, your last little bit of telling people to generally be healthy, being in the medical community and then being in the office for the last 6-7 years. I love hearing some of the advice, and I shouldn't say some. I love hearing the advice as I'm walking down the hall. I can hear you talking to people saying, hey, this is how we're going to help you with tendonitis. This is how we're going to help you with Lyme. This is how we're going to help you with the different things. To kind of summarize and put the icing on the cake, what's your takeaway advice for people to be healthy?
So number one, starting to like love yourself.
Right. And that's hard, isn't
It's
it?
hard.
Because we're our own worst critic
Yep.
and we beat up on ourselves.
We do. Not taking ourselves too seriously, having fun. Sleep, number one. We've got to sleep. People are not sleeping. And like you said, it might be from technology, all those things. But that's neither here nor there. But number one, sleep. Nutrition, whether it's food in the forms of food and then also supplementation. We all need to have some sort of supplementation. It's just this fact. Not something that we promote in regular medicine, but obviously we do now because we're at the clinic. And then water, making sure you have at least 64 to 72 ounces of water a day. Maybe some less, maybe some more depending on your body weight. But water is just so important. That's one thing that I've tried. I don't usually make resolutions, but that was one of my things that changed this year is to actually get at least 64 ounces of water every day. So far, 4 to 5 days into it, it's working. So
Yeah, that's almost a habit.
yeah, and then getting out into nature and making sure you're exercising too. We're made to move. Not that you have to work out for hours and hours a day, but just getting outside and moving, or getting on your treadmill if it's icy and snowy and whatever. But getting movement.
Okay, guys, that is really our segment. Shelby, thanks so much for joining me. I
Thank
know you
you.
were worried about it. I was kind of worried about it. Like, I've done tons by myself. I'm like, nope, I want to branch out. Special thanks to Jordan, our producer. You guys
Thank you,
can't see
Jordan.
him. He's over here. And to the crew that was helping me last night. A shout out to Caden and Kendall, who were in here working on camera angles and lighting and some other things. So this is our first podcast guest that we've had, not only video and audio. And again, you can pick us up on Spotify, on Apple iTunes, YouTube, Facebook, and this is available as replay. And we have a free ebook associated with that. We're here every Wednesday night at 6 o'clock doing these, getting people information, because our tagline is "You're not your diagnosis." There's a person in there, and if we make the cells healthy, we make you healthy. It's not just us saying it. We've got tons and tons of testimonials on our website and our YouTube channel, and I usually do that on Thursdays where we bring someone in, and we have an amazing story that you're going to see tomorrow, just on what it happens when someone that was told they had autoimmune, they were told they had lupus, and then they beat it. And it's a wonderful, amazing, motivational story. Dr. Jason West and Shelby signing out on the West Clinic team, and we'll see you guys on the next podcast.